Hey there, Professor Zeeb here again, and welcome to our next video lecture. This time, what I'm going to teach you and what we're going to talk about is the effects of lifestyle on our health. A lot of the stuff we're going to mention in this video lecture is stuff we're going to cover all semester long. A lot of common themes are going to be represented. A lot of it's obvious stuff, but we're going to get specific with the research and look at some studies and things like that, all right? So keep in mind, once again, there are certain things that we can't control that are related to our health, but definitely there are some things that we can control, certain lifestyle factors, choices we make, for example, whether we choose to vape or to drink alcohol excessively. Those are the kind of things we're talking about, different lifestyle choices that are linked to health problems and thus affect our developmental course is kind of what we're going to focus on here. All right, so let's get to it here. Okay, so we're going to look at the effects of lifestyle on health. First area we're going to cover is choice of foods. In other words, what you choose to eat as a human being obviously matters. So once again, nutrition is vital at every stage in development. So we're going to talk about this all semester long. Every stage literally that we talk about, nutrition is essential. But really why we're concerned here is that obviously there's a link between cholesterol and heart disease, okay? So in this particular case, we're looking, what we're going to focus on is low density lipoproteins, which leave deposits on the walls of blood vessels. So in other words, if your diet contains a lot of this sort of cholesterol, what we call bad cholesterol, and by the way, this is found in red meat, whole dairy products, for example. So if your diet consists of that, you're eating steak every day and lots of cheese and things like that, it begins to block the flow of blood to your heart and your brain because these deposits build up and create a strain on the heart, okay? So once again, this is linked to a fatty diet. Well, what are some simple changes you can make as a human? So please think about this, guys, as you prepare lunch in the next hour or so, or whenever you're going to eat. Let's say you love to eat red meat. What's a simple option? Well, then you would choose things like fish, especially cold water fish is really good, and poultry rather than red meat. Okay, if you loved whole milk, maybe a simple change would be skim milk. Those are the simple changes that you can make in your diet that can make all the difference to lower your cholesterol levels, because we know this is horrible for your heart, okay? Obviously, you also want to couple this with exercise. Okay, so exercise is going to be another common theme. So please think about that. A lot of experts basically believe that we live in this obesogenic world or society where we're encouraged to increase our intake of food, to eat unhealthy food, which seems so attractive at times, and to live a sedentary lifestyle. So unfortunately, that sort of push has gotten us in trouble, not only with our waistlines, but also our health. And so certainly by the time you're an adult, that starts to catch up with you. And so you got to be really careful about that. Scientists have also established a connection between diet and cancer, certain types of cancer. Those include breast cancer, stomach cancer, cancer of the intestines, and cancer of the esophagus, the tube that leads from your mouth to your stomach. So all that kind of makes sense. We know that certain diets or unhealthy diets are linked or increase the chance of getting those types of cancer. So the American Cancer Society has made the following recommendations to help to prevent this and to avoid these problems. Number one, lower your fat intake to less than 30% of your daily calorie total. So lower your fat intake to less than 30%. And then number two, eat more fiber. Apparently a lot of people are not getting enough fiber in their diet. So you want to increase foods that have fiber. Okay, what are those? Well, those would be things like leafy vegetables, cauliflower. I don't know if you guys like cauliflower, broccoli, which is such a really important healthy food, Brussels sprouts, whole grain cereals and breads. So you want to make sure you're incorporating those into your diet. In other words, eating wheat bread rather than white bread, that kind of thing. So those are two simple things that you can do to help prevent cancer due to diet problems, okay? Unfortunately, a lot of these foods are not as convenient as, say, fast food. And so that's where we often get into trouble because we're on the go. We live this very active, busy lifestyle, which gets us into trouble. So please take time out of your day to prepare those fresh vegetables and vegetables that have lots of fiber and other foods that have fiber as well. Obviously, the choice of foods you make is linked to obesity. If you guys listen to my previous lecture on that. So we're going to look at some numbers here. We look at the study that was done in 2016, 20 to 39-year-olds. So if we look at that age range, 20 to 39, about 29.5% are overweight and 34% are obese. So wow, that shows that a lot of people are struggling with that. They've even predicted by the year 2030, 42% of our population will be obese. So wow, those are enormous numbers, if you would, of people who are actually obese, as we discussed earlier. Our country, the United States, also has one of the highest obesity rates in the world. Let's look at some data here. So countries with the highest and lowest percentage of obese adults among 30 developed countries, so it's limited to those countries. They've broken it up by men and women. So notice we are one of the highest nations here. Mexico, Chile, New Zealand, United Kingdom are among the highest. And then our lowest would be Italy, Norway, Switzerland, Korea, and Japan. So we are in the top few countries there with the highest obesity rate among developed countries. So obviously, as Americans, we do have this problem where we want to eat big and we're encouraged to eat this unhealthy stuff. So guys, please think about that. It's obviously a huge problem. It's linked to many problems, as we said previously in the class. All right, so we are going to transition now. And now we turn to alcohol. So now people can drink legally for the first time once you become an adult, obviously, okay? Obviously, things like substance abuse, alcohol do emerge in adolescence a lot. But if we're going to play it safe here and say, okay, this is the legal time you can actually do that, it's obviously a big problem, a big concern. Okay, so let's look at alcohol use here. Let's look at the prevalence or how common it is. Obviously, it's extremely common in a country like ours. So they interviewed college presidents, apparently. Some study interviewed college presidents and asked them, what is the #1 problem on campus? Gee, what do you think that is? So the #1 problem was drinking, especially binge drinking, which is very popular among the college crowd, okay? One of the reasons we're concerned about that is it's often linked to sexual assault, unfortunately, okay? So highest prevalence in binge and heavy drinking, ages 18 to 25, especially around age 21. So we know that population specifically are the ones who like to binge drink. Binge drink, by the way, means you're having like 4 or 5 drinks in one gathering. So in other words, a short period of time, you're drinking excessively, okay? So we know that early adulthood, especially the early portion of that, is one of our highest populations to partake in that. All right, so why do people drink to begin with? There are several reasons. Obviously, alcohol is extremely addicting. In fact, in some heavy cases, people get the shakes when they don't drink the next day, and they may drink to stop that. Okay, so there's some heavy duty withdrawal symptoms. Alcohol dulls your senses and allows you to escape reality. So it may be one way to forget about life for a while, to relax in that sense. Alcohol is a depressant, so it does relax you in that sense. Obviously, social reasons play into drinking because people go out to clubs and bars and things like that and hang out with their friends. It lowers inhibitions, with people. So once again, it helps people to kind of loosen up, if you would. So there's social reasons for that. We also have genetic reasons. Sometimes people are born with a predisposition to drink. So certain types of alcoholism have shown hereditary ties. So obviously there are a lot of reasons to drink. So once again, binge drinking specifically seems to peak around 20 or 22 and then declines through the 20s. So we know that your highest risk or highest age risk of doing this is your early 20s. All right, so what's the big deal? If you drink, what's the big deal? How is it a problem? Well, it is linked with several health problems. Let's start out with the positive. There may be some evidence that it actually can be beneficial. You know, things, especially things like red wine have been shown to lower cholesterol. So some studies are showing maybe 1 to 2 drinks a day or in moderation is the key there, can actually be beneficial, but typically when you're younger, okay? However, when you get over 50, that does reverse, and we'll talk about that later, okay? The problem is, can you stop at 1 or 2 drinks? Some people can, some people can't. It's very addicting, and 1 or 2 often lead to 3 or 4. So it's hard sometimes for people to drink in moderation. So alcohol is linked with many health and psychological problems. You know, I'm just going to list these off. I just want you to listen to this. This is a pretty impressive list in terms of how many problems are connected to drinking, because you have to realize anytime you drink something, it's going to come into contact with every major organ in the body typically, or just about. So it's going to be related to a lot of problems. Okay, so just listen to this list. So it's linked to liver damage, vitamin deficiency, brain damage, cancer, diabetes, heart disease, stroke, and high blood pressure, ulcers, birth defects, colitis, which is inflammation of the colon, which doesn't sound too wonderful, pancreatitis, bone marrow problems, learning problems, depression, injury from accidents, and of course, sexual problems. This has been documented for centuries. In fact, there's this famous quote from Shakespeare himself. This comes from Macbeth. It provokes the desire, but it takes away the performance. In other words, it leads to impotence in men, especially. Okay. So the point is, this isn't even an exhaustive list. This is just, you know, some examples. It's linked to many, many different health problems. And not only that, heavy drinkers often experience heavy-duty withdrawal symptoms, which include things like hallucinating, anxiety, nausea, tremors, the shakes, as we said before. So it is linked to some pretty hardcore stuff there. All right, they also found that college students, to relate it to you guys, college students who participate in drinking frequently are more likely to miss class, which obviously isn't good for your college career. It's linked to injury, troubles with the police, which obviously is not a good thing, and having unprotected sex, which is linked to several problems, as you can imagine there, okay? Binge drinking students are twice as likely to have unprotected sex and 10 times more likely to drive after drinking compared to non-binge drinking students. So I thought, wow, I thought that was pretty interesting and powerful there, okay? So even though in some cases, moderation alcohol can be healthy to a certain extent, it does have some positive benefits in terms of loosening people up and relaxing them. But the problem is that it's linked overwhelmingly with all these health problems and is clearly unhealthy for you. All right, we are going to switch gears. And next we go to tobacco. So tobacco is the leading preventable cause of death in the United States. So obviously this is a very serious one. In terms of our prevalence of tobacco use in our country, it has definitely been going down. So the rates have been dropping, probably because we've understood over the course of time how horrible it is for your health. Okay, so I mean, obviously everyone knows that since we were children. You've been taught that. So we know that the rates have been going down. You guys have probably been hearing all the news involving vaping. how, it seems like vaping was marketed as this healthy alternative to smoking. But, in recent months, there's been all these crazy stories in the news of people getting lung disease from vaping. So even, things like that are not healthy for you and so forth. And really, I want to see what the long-term studies are going to say with that. We need more longitudinal type studies with vaping to really understand what's happening with that. But clearly, the preliminary studies are not good, and it's linked with a lot of problems. Okay, so let's look at tobacco use. Now, in this case, remember, we're talking more about cigarette smoking, cigars, things like that, rather than vaping. The problem with smoking cigarettes, as an example, is that it contains many other things than the tobacco, including nicotine, which is a stimulant. It contains tar, carbon monoxide, and several other chemicals. Smoking is linked to premature death. We said it's the leading preventable cause of death in the United States. It's linked to lung and esophageal cancer, as well as kidney, bladder, and pancreatic cancer. So it's linked to several types of cancer. Obviously, it's linked to heart disease because it increases heart rate and blood pressure and reduces your oxygen supply, thus straining the heart. So it's linked to heart problems. Get this, according to research, smokers are 14 times more likely to die from lung cancer and twice as likely to die of a heart attack compared to non-smokers. I mean, wow, that is incredible and obviously kind of alarming and scary at the same time. Smoking is also related to wrinkles. So I don't know if you guys know people in your life that have been smoking for several years. A lot of times they have a lot of wrinkles. I mean, that certainly rings true in my experiences of some of my older friends that have smoked for a long time. It's also linked to damaging your eye. So studies have also shown it limits your night vision capability, or your ability to see in darkness or near darkness. So it damages your eye. All right. There are some studies that also show personality differences between smokers and non-smokers. So this particular study we're going to look at focused on young women, since obviously this is the target population of the lecture here. So they compared young women who smoke to young women who don't, and they found some personality differences. Now remember, this is not causal data once again. They just found that it's more likely to occur in the smoking population. Number one, they tend to be less athletic, study less, dislike school more, tend to be more social, and get lower grades. I kind of think about people I know or students I've had that smoke. I mean, I hate to generalize here, but that seems to seems to be some truth there in my opinion. I've kind of seen that pattern personally. I've been working in the college population for 15 years and obviously was a student myself at one point. To me, I've seen that a lot. I've seen that sort of pattern when I compare young women who smoke who don't. Okay, why do people smoke? So what are the reasons for smoking? I mean, probably one of the biggest reasons is addiction. I mean, they've compared the addictive qualities of nicotine to heroin. And heroin is one of the most addicting drugs there is. So we know it's pretty addicting. You could argue that peer pressure may play into this, especially in high school, right? Some people argue that it makes you look fashionable. I don't know if that's true anymore, but that's been cited as some reasons. Some people cite the reason that it helps them to lose weight because it is a stimulant. They're saying that it burns calories. When we look at the actual research for this, it actually contradicts it. They've found that smokers are just as likely to gain weight as non-smokers. So apparently it's not enough to create a difference. Maybe smokers who are showing weight loss are doing other things in combination with that, and that may be more important. A lot of people cite a reason for smoking is that it helps them to relax. Have you guys heard this? Oh, I need a cigarette to help me relax. Do you guys understand the irony of that? Nicotine is a stimulant that makes your heart beat faster. So that always kind of puzzles me when people say that. I think what they mean by that is that it it relaxes their addiction. I think that's probably a better answer rather than saying in general, it helps the body relax because it is technically a stimulant. All right, you could also argue that younger smokers, it may make them more or appear more mature. So certainly with a high schooler, I remember in high school when people smoked, it kind of made them look older. So maybe they're sort of searching for that something to help them mature and look older to their peers or something like that. So that may be another reason. So there are several reasons. Unfortunately, not only does tobacco use endanger the user, it endangers those around us, okay? So we're talking about passive smoking. Most people know it as secondhand smoke. Research has shown that it is harmful, even though you're not smoking the cigarette yourself. It's been linked to lower respiratory infections in children. So think about, guys, these poor kids whose parents smoke and choose to do it inside, and they're just sitting there bathing in that smoke and breathing it in. You know, it's got to do something. There's probably some kind of effect of that or consequence of that. So research has shown a lot of kids are susceptible to that with parents that smoke or being around people that smoke. And obviously this is why a lot of legislation has been passed to ban smoking in public places. You know, when I was a kid, they used to let you smoke on airplanes. You know, we're all sitting there in this small cabin next to people and they're smoking, we're all breathing that in. It's just amazing, like restaurants especially. So it's amazing how that's changed, like even in public places like the beach, they've changed that because I think we've understood how dangerous it can be, okay? So you have to kind of think about that. All right, anyway, so the point is just to kind of wrap this up, guys, there's several things that you do in terms of choice in your lifestyle that can have pretty drastic effects on your health. And certainly by the time you get to middle age, you will really start to see those effects in a big way. So maybe when you're young, in your 20s, you can get away with some of this stuff. But a lot of times when you get to my age, you see the ramifications of all your life choices. So something to think about. You really have to be careful. Remember, the common denominator basically is don't drink or smoke, eat healthy, and exercise. I mean, that's going to be the common theme of the class. We're going to talk about that again and again. And there are so many studies that show the benefit of those three things. All right. So hopefully you found this lecture enlightening to you and educational. And I hope you're enjoying the class, and we will see you online.